This lesson is on public health and health determinants and the things that affect our health as a community. So, one thing that people who study public health are really concerned about is health equity. And this is ensuring that everyone has the same chance to be as healthy as possible, which also includes having the same access to healthcare. And so they're not being disadvantaged because of where they work, where they learn, where they live, where they play, or any of the access to those things. When we don't have health equity, we have health disparities. And so these are differences in the health outcomes of different groups of people. So it could be mortality rates or HIV/AIDS rates or diabetes rates or anything like that in different groups of people. And different groups of people that can have health disparities are typically different races or ethnicities, lower socioeconomic status folks, anyone who has limited access to health insurance, which could also include immigrants, refugees, asylum seekers, or people who live in more rural areas or territories that have less access to healthcare. It could include members of the LGBTQ plus community, younger folks, older folks, individuals with disabilities, anyone where discrimination might prevent them from getting the healthcare that they deserve or that everybody deserves. So, health disparities, like I said, can be different health outcomes, like the rate of people who have stroke or infant mortality or different cancers compared to other groups. But discrimination is also another cause of health disparities because discrimination can cause us to change our behavior, like avoiding healthcare due to fear of discrimination or improper treatment. So, public health experts look at risk factors to be able to avoid health disparities and promote health equity. And so, risk factors are things that increase a person's risk or chance of either being exposed to an infectious disease or agent like the flu, or being exposed to or experiencing a non infectious disease like heart attacks or diabetes. So, risk factors could be things like drinking unclean water or being in a crowded indoor area. It could also be things that are genetic, like having the BRCA1 gene is a risk factor for breast cancer. And so public health experts can calculate a risk factor. And this is basically a comparison of how many people have a disease when they do this risk factor versus how many people have the disease when they don't do the risk factor. And so it quantifies or it measures how strongly associated that factor is to a certain disease. And if the risk ratio is 1, that means that whether you do the risky thing, the factor, you're going to have the same risk as those who are not exposed. Okay. Above 1 means that the people who do that factor, whatever the thing is, have a greater chance of getting the disease than those who don't. So an example here on the right would be like with the BRCA1 gene, people who have that gene are 6 times more as likely to develop breast cancer than those who don't have the gene. And so the larger that number, that risk ratio, the stronger the association, the larger the chance that disease or illness develops. And I will say this isn't causal. It's not saying like if you have this gene, you're going to get breast cancer. It's just an association. It's just it increases your chances. If a risk ratio is less than 1, we actually call that a protective factor, which means that doing that thing, that factor, is actually making you less likely to get a disease or illness than people who don't do that thing. So examples would be like getting your flu vaccine. If you get your flu vaccine, you're less likely to get the flu than people who are not vaccinated. Or wearing sunscreen makes it less likely that you get skin cancer than people who don't wear sunscreen. So we can categorize risk factors into 3 different groups. And the first is biological. And so these are risk factors that we don't have control over, things like our age or our genetics. That is just passed down to us, it's inherited, or we age over time and we can't stop aging processes. Okay. However, we can make behavioral choices that are either protective or risky to help kind of prevent anything that may be related to our age or our genetics. And so this comes down to behavioral risk factors, which are things that we can control. These are our choices. So this would be whether or not you smoke, how much exercise you do, your lifestyle choices, like do you eat healthier foods and drink lots of water, or are you making lots of high sugar, high fat dietary choices? Are you washing your hands? Are you getting vaccinated? So we can choose protective factors that help prevent disease, or we can choose unhealthier risk factors that are more correlated with disease. The third category of risk factors are called environmental risk factors or the social determinants of health. And so there are 5 of these, and they're not always within a person's control. We may say that some of them are. So, for example, education is the first one, and you might be like, well, you can choose where you go to school. But a lot of things go into that decision, right? If you can afford a 4-year college, or if you are have enough money, if you can travel out of state, or if you are getting scholarships. So there's stuff that we can't control that affects these 5 categories as well. And so, like I said, education access, typically the more education that you receive, the more likely you are to get a higher paying job, which leads to more access to health insurance and quality healthcare, which is the second social determinant of health. And so the more health insurance that you have, the better your health insurance is, which usually is related to your job. Is better for your health outcomes, but that's also the quality of healthcare. So people who live in more rural areas typically don't have doctors or providers who are trained in different specialties. They're more general, and so they might not get exactly the care that they could get if they were in a larger city. Okay. The third social determinant of health is neighborhood and built environment. So this is, do you have stable housing, or are you maybe foster and you're bouncing around to different homes, or even homeless? This also includes your water quality and your air quality, your access to healthy foods, whether you have enough money to buy healthy foods, because those are typically more expensive, and whether you live in an area that has low crime rates, you're not scared of violence, all that kind of stuff. Social and community context is your relationships and your interactions. Are you in a workplace that you feel safe and belonging? You're not being discriminated against. Same thing, are you in a community where you feel belonging and comfortable to have access and go get things that you need? And then the last one is economic stability, which kind of filters in with all of those, right? If I don't have a stable, well-paying job, I'm probably not going to have access to those other things. And so there's a lot of factors that go into whether I can get a job that is stable and well-paid. Okay. So that's kind of sad and gloomy, but there are lots of solutions for health disparities. And some of those are cultural competency training for healthcare providers. So this can help us reduce discrimination in healthcare and ensure that people feel comfortable coming to healthcare providers, that they're not going to be discriminated against because of their race or their religion or their ethnicity, their language that they speak, anything like that. We can also increase education for people who are at high risk for certain diseases. So Black Americans are more likely to have diabetes than their counterparts of the same age. And so if we can educate that group of people about diabetes prevention and lifestyle choices, then we can help reduce their risks and their health disparities. But we can also increase the number of health professionals that are going to rural or low income areas. And like I said before, we can get more specialties out there. We can provide career counseling or education initiatives like scholarships or fund public schooling so that we can help increase people's access to education, which increases their access to job stability, which increases their access to health insurance and health care. And we can maintain those policies kind of on a social legal level as well, for housing, healthcare, food, all those sorts of things. And the people who do that are typically people who work in public health, and our behavioral scientists could work in policy, could work in epidemiology, they could work in environmental health. All of these things kind of look into studying the risk factors, educating people, and promoting policies that help promote health equity.